Welcome to Oncology Spotlight, a podcast where we interview those who are working on the war against cancer, brought to you by the OncoAssist team. Today's our guests, we have the brothers who are raising the bar in community oncology through their popular Twitter handle, Oncology Brothers. I welcome Dr. Rohit Gosain, a medical oncologist at UPMC Hillman Cancer Center, and Dr. Rahul Gosain, medical director at Corning Cancer Center. Thanks for joining us today, guys.
Thank you, Kevin. Thanks for having us.
Just to kick off, can you both give us a brief introduction of yourself and your medical background?
Yeah, I'll start, given that I'm the older physician out of the two brothers, though I'm younger. I did my undergrad in McMaster, Canada. So I'm one of those. I'm Canadian. And for my med school, I pursued my medical school in Caribbean. Thereafter, I did my internal medicine residency in Baltimore, and then my hematology oncology fellowship in Louisville, Kentucky. Ever since then, I've been practicing in upstate New York, while I'm also pursuing my part-time MBA, again, back in Baltimore.
Yes, he's certainly the senior oncologist. Well, thank you so much, Kevin, for having us over. But we have been using your OncoAssist app, and it is certainly a game changer for a community oncologist setting. So thank you so much for that innovative app. I started off my career as a computer engineer, and while I was doing that, I always felt that I was missing some humanistic element to my careership battle. As a result, I talked to the senior doctor, that was my brother Rahul, and he persuaded me to at least give medical field a try. As a result, I did my pre-medical course, and I really enjoyed it. In fact, as a result, I stepped into the field of medicine, and I did my the residency up at Baltimore following my med school up in Caribbean. And following that, I did my fellowship at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Right after that, I stepped into the career at UPMC Hillman Cancer Center as a community oncologist, and I have been practicing for about 2 years' time now following my fellowship, and it has been an incredible experience.
Wow, that's impressive. So you have the background in software and computer science as well as oncology.
Yes, I post computer engineering, I was working as a software consultant where I programmed in Java, C++, and so I have that combined with the medical, yes.
Amazing. You must have a lot of different ideas and see a lot of different opportunities in the space, I can imagine.
Right. It was a great thing to combine the two. As a result, we did step into the learn from apps world, which was combining the technology and the medical aspect of it. And Rahul was the sort of the brains of that, being a senior medical person in there.
Cool. And what motivated you both to study oncology?
And actually, just to clarify something, my initial intent was if I bring Rohit on just to introduce him to pre-med, he's going to run away from it. But clearly that did not work. And here we are. When it comes to oncology, fortunately, I personally don't have a story where I can tell you that, oh my God, it was my family member that was diagnosed with cancer that made me pursue this field, which often is the case. But I think we got lucky to run into the right mentors when we were in med school, in our internal medicine residency, and see how big of an impact a physician was making, not just in the patient, but as a family as a whole, and how fast this field was moving. So those two aspects really intrigued me, and that was what really made me pursue hematology oncology, to a point where all my other colleagues were exploring GI, cardiology. I really thought I was missing out on something, but retrospectively, I am so glad that it worked out the way it did.
Of course, yeah. And to kind of go back, why did you choose medicine? You know, obviously, Rohit went into computer science first. Was there something that motivated you to move into medicine?
Yeah, I think a lot of that was just the upbringing. Rohit and I were born in India, and then parents moved to Canada. From get-go, I was always pursuing higher education, and there were only two that were thought saying, you know what, as an immigrant family, you have to pursue a career that will give you, one, a respectable career, and second, just a safety net. And it was always go in medicine or go in engineer, become an engineer, go in medicine or become an engineer, till they realized that Rohit was going to do both. So I ended up being the black sheep of the family. But initially, it was more so just to push and the upbringing.
Cool. Very good. Very good. And Rohit, for you in oncology, was it just your conversations with Rahul, or was there something specific that moved you in that direction?
Certainly, that was a huge part of it, but I must add that how oncology as a whole is such a unique field where it encompasses the patient care physically, mentally, medically, and on top of that, you add the family aspect of it. Those are some unique combinations hard to find in any medical field for that matter. And the gratification, though there are some ups and downs with the gratification aspect of it, because you have this connotation tied with cancer, unfortunately, of death, though we are changing that field quite rapidly, where patients are living much longer, and that's where the gratification aspect does come in. But other aspect of the oncology has been this incredible research aspect of it, where the field is changing by the minute, where you are seeing myriad of FDA approvals in the field, and how incredibly changing this field is. So keeping it fresh every day and challenging has been some of the important aspect of what has kept me sort of motivated in the field of oncology.
Very good. You're both community oncologists, so that might not be a term that's familiar to all of our listeners. Could you explain what the difference between a community oncologist and maybe an academic oncologist is?
Yeah, for the most part, in academics here, as an oncologist or hematologist, you get a chance to focus on one particular disease site. So it could be thoracic, it could be breast. Nowadays, depending on where you're practicing in that academic society, you might even further subspecialize. There are oncologists that are only seeing HER2 positive breast cancer or triple negative breast cancer. Whereas as a community oncologist, you get a chance to see everything. Today, my patient list would look like iron deficiency anemia to someone who has hemolysis going on, and then breast cancer and prostate cancer and lung cancer. So as a community oncologist, you are serving the patient need as a generalist.
Okay. But you guys only focus on solid tumors, is that correct? Do you do?
No, both Rohit and I are certified in hematology and oncology. So we will see leukemics, and then we'll also see solid oncology. Granted, at least on my end, we are not a transplant center. So we'll often just tie up with a tertiary or quaternary center where they can get part of their induction chemotherapy, and then we'll continue to provide supportive care. Or again, to what Rohit was saying, how fast this field is moving. Now, with drugs like venetoclax or hypomethylating agents combined, we can at least start treating those frail elderly patients, even in outpatient settings. So some of my patients are getting that treatment here actively.
Cool.
Right. I'll just like to add to that is that how community oncologists literally we have to wear so many hats at the same point, where you are seeing a breast cancer patient, then bladder cancer, and all of a sudden you're seeing as benign as it goes as iron deficiency anemia patient. So one really has to focus a conversation around those topics, but at the same time stay up to date in the field of hematology and oncology aspect of it. So it is its own challenges, but again, how rewarding it becomes is certainly overcomes that.
Of course. And that brings me to my next question. What are some of the biggest challenges day to day as a community oncologist in the US?
I think from our perspective, being a generalist, just in 2021, there were more than 40 new drug approvals or indications by FDA. So I think the biggest challenge ends up being staying on top of that. And then we know historically there is especially from what Rohit have studied in his research as well, a disparity between the outcomes in rural settings and urban settings. And I think that I take that very personally, and I want to make sure that at least being in the community, we can do anything and everything to make that gap smaller and smaller. Granted, part of that is socioeconomic status, education level of our patients when they tend to seek care. Along with that also ends up being how much we know as a community oncologist. How can we tie up with the tertiary and quaternary centers? So I think everything ties up, but the biggest challenge ends up being how fast this field is moving.
Right. So the community oncologist challenges are several, mainly staying on top of the field itself, because how this field is changing, as Rahul mentioned, about 30 to 40 approvals by FDA in the field of oncology in just 1 year. Of course, I'm sure that there are other fields changing as much as just many amount of FDA approvals, but the amount in oncology is just humongous. And then you add knowledge to know the indications of these drugs and then side effects, leave apart patients staying up to date or telling us about those side effects, staying on top of that. And then these indications is very challenging. As a result, involving into the social media aspect of it or staying on top of the CMEs and participating in ASCO conferences, ESMO conferences, MedOnc Twitter becomes evenly more important to sort of indulge in, so you can, of course, stay up to date with everything.
Yeah, of course, of course. What excites you most about the industry at present, in terms of new developments, etc.?
Yeah, so I think even though this is our biggest challenge, how fast the field's moving, I think that has to be the most exciting part of oncology, how fast the field is moving, ironically. I think more recently, the term precision medicine has been thrown around for every single thing. But I think individualizing patient care is very exciting. Finding actionable mutations and targeting that so that now you're being specific with less side effects and better progression-free survival or overall survival for our patients is huge. 5-10 years ago, when even as far as when I was training in internal medicine, you could go to one conference, ASCO, and you could learn everything. But now with ASCO, ESMO, monthly ASCO plenary sessions, every single month or even weekly, there's something practice changing happening. So I think that it's challenging, but that is something that's very exciting on our end, because you can come back and tell these patients that, oh my God, let's try this. And this is shown to make a significant benefit. Just an example, nowadays, ADCs in breast cancer is changing how we treat second-line breast cancer for HER2 positive patients, TDM1 versus TDXD. There's a huge difference. And you don't have to wait for ASCO for that to happen. Just recently, the NEGM article showed a significant benefit. It was, again, in second-line settings, this is day in, day out what we're seeing in oncology. And I think it's very gratifying and it's very, very exciting.
Right. So from the community oncologist, just to add on top of what Rahul said, how exciting this is one is the research aspect of it, and the other aspect is the patient, where one has to, as I mentioned, wear so many different hats when you're interacting with bladder cancer, breast cancer, colon cancer patients, and talking about these drug approvals, indications, side effects. So every patient presents with its own problem-solving capability here, and you add the emotional and mental aspect of handling the patient and their family. So adds a huge amount of gratification when these patients come out as survival or they call themselves cancer-free. And the other important aspect is the research. As Rahul mentioned, there have been, interestingly, about 40 FDA approvals in just alone 2021, and the research that is still ongoing, and staying on top of that is just humongous responsibility. So all in all, I'd say the gratification aspect of it comes with all the hard work that gets put in, which is nice to actually get rewarded that way, but one has to, of course, stay on top of everything. So there are challenges, but it is well worth the shot.
Of course, you can imagine. That brings me to the question, can you tell us why you decided to start Oncology Brothers? What was the motivation there? Obviously, you have some great data. I see, like, you really keep on top of the research, which is great to see.
Yeah, I really think that it was more of a selfish motive, to be honest, saying how can we stay on top of ongoing research or practice
Mm,
changing drug approvals. Almost every single day after work, Rohit and I jump on a phone call saying, hey, how would you treat this patient? Or, hey, did you check out this approval? Or did you look into this study? And we would always go back and forth. And we started this Twitter handle back in August. So we were rather
mm,
very late to the social media game, with just one idea that can we learn and do better for our patients, not realizing that there's going to be a lot of traction to this, and there'll be really good feedback. So initially, when we started, the goal was, can I stay on top of all the advances and
mm,
learn from everyone? And it's been a great journey in just last, 8 months.
yeah. More than 2,000 followers already. It's been amazing to see it grow so quickly.
So talking about the Oncology Brothers Twitter handle, it's funny Rahul mentions that our journey, our spouses both hate us for this because we spend about 5 minutes of talking to them and 55 minutes talking to each other about this oncology, how it is a rapidly changing field. So it always giggles me because the Oncology Brothers, we've always thought about doing things together. We've always been
Mm,
involved in doing things together outside of the Twitter space, and this is another addition to that. So certainly it's a selfish reason about staying up to date for ourselves, but importantly, when we started this, we never thought that how incredibly important this was going to be for us, because this way we are able to stay on top of everything.
mm,
And on top of that, we are learning a lot about the field, and interacting with some of the remarkable minds out there who are changing the field in their space, that is breast cancer, colon cancer, how welcoming they all are to answer questions for community oncologists. Again, it becomes very hard for us to even stay on top of everything. And now you add this element of so many changes coming all at once, the indications and the testing for the immunotherapy, PD-L1s, and don't want to get into the technical lingo of this, but this Twitter handle has been rather a great blessing that way. And staying on top of it has definitely helped us to improve patient care and stay on top of the field for the patients and their families.
Yeah, and
yeah.
I think the other thing about at least the Twitter handle, there are a lot of specific academic people focusing on, again, lung cancer, and that is what they'll continue to tweet about. Then you have breast oncologists that will continue to tweet about ongoing changes in breast cancer. Whereas being a generalist, it gives us a chance to literally focus on everything. Often Rohit and I will see a patient and then go back to our own Twitter handle just to look up that study and then go back to that reference so that we can talk about the key points to our patients. So I think it gives us a chance to have everything for a general oncologist on one page.
It really is very impressive. So have you had has there been any big learnings since you launched it, since August, I guess, 8 months, is it? Like what's been the main learning from your side?
I think two things. Back in November, when we realized that there were so many approvals, Rohit and I decided, just again for our sake, for our clinic, I have those tables printed out. We decided to just have a comprehensive table of all the approvals, what study, and what indications. Because again, when you're looking at bladder cancer in adjuvant settings versus breast cancer, and now you have adjuvant approval of IO in gastric cancer, you really want to make sure that your patient one qualifies and what to expect from it. So we decided to just create those tables, and then just decided, sure, we can share that with everyone. And we got a lot of feedback, and importantly, some physicians even said, all right, there was another approval, let's add to that table. And we had a chance to learn from it. And then second learning experience with this ended up being just creating polls and learning from everyone around that. Initially, we just shared a lung cancer poll of a cancer patient. And we had almost 400 or 500 people weigh into that vote, and that generated a lot of discussions. We had quite a few community physicians and fellows reach out to us saying that they learned a lot from it. So we decided to continue with polls every other week just to have cases to generate discussion and, more importantly, learn from it. But at the same time, I think there has to be an important learning part from this, that whenever you're creating these polls or looking for feedback, some of the patients and their family members are on social media. So you have to be very careful with the information you share or to what degree you share. You're trying to learn a concept. You're not trying to expose a patient with what they're coming in from. So I think that's also very important.
Of course, of course.
Right. In addition to what Rahul said, it has a tremendous, it has been an incredible learning experience, rather. We never even thought about exceeding about more than 2,000 followers. So that was something interesting, because when we started this journey, I don't think, at least I never thought that we'd be focusing on any of the followers. But when I, the other day, looked at it, I was like sort of amazed by it, how many people, and the sort of the caliber of people who are following has been incredible. From learning aspect of it, I must say it has truly changed the practice, because there have been times when I've just gone to our Twitter handle and searched the indication, because it can be presented in just a tweet, for that matter, and a rather quick glimpse. And the other gratifying experience has been there have been friends who were more Twitter savvy than Rahul and I, and they called and rather texted us saying that how they have been discarding some of the number of followers they had, and they're just focusing on our Twitter handle, and they make sure that they look at our Twitter handle once a day. So that itself has been sort of rewarding, because we are able to, of course, help ourselves as selfishly as we stated, but at the same time able to benefit other community oncologists which are going through the same struggles of keeping up to date with so much being thrown at them every minute.
Of course, yeah.
But I don't think you and I have chatted about this. I don't think we ever really discussed like the growth or the numbers or the followers on Twitter. But like what you said, I think initially when we started, I thought maybe 10 of our friends will follow us at its best, just to see what's going on. And initially the goal was, this will be my go-to place where we can just go back and refer to ongoing studies or data from ASCO or GI, ASCO. And the other thing that you touched upon was how welcoming on Twitter, these like leaders in each of their field have been. Like how many times I've reached out to so many of them, and within hours they'll get back saying, I will consider this, or hey, let's consider another option, or what about RNA versus DNA sequencing? I think that each one of them has been very welcoming, and that's been to some extent overwhelming how nice they have been.
I think with the number of followers, we never focused on it, but at the same time, we did earn the bragging rights to our spouses when we were over 2,000. So that was interesting.
It's been brilliant to see. And your other venture, Learn from Apps, the company you guys founded, could you tell us a little bit about it?
Yeah, I think part of that was with Rohit's background in computer engineering. So we did not really worry too much of the back end, because Rohit had a good understanding of that. But we've always both felt that there was always a lag between tech and medicine. Even now, like with there are, I don't know, 15, 20 different EHRs, EMRs, just in the region I am at, and just communicating from one end to another hospital ends up being so cumbersome. So we've always felt that there has to be a big need connecting the medicine and tech. So initially it was a very basic start. Hey, can we put some apps, static apps with mnemonics or buzzwords to help medical students or residents, some of those apps that we were using or the content we were using just to learn for our exams per se. And then that turned into another project leading into a question bank. And at one time, Rohit, we had almost 4 or 5 different question banks. USMLE Step 1, internal medicine, even for nursing, with the idea that as a user, can you get one question a day? So it's a small bite for you to absorb, and you continue to learn as you go along. So you'll have one question a day, and you see how you're doing amongst your peers. And it will give you some feedback saying this is the right answer and why, with some explanation. And that had a good run. And right now we still continue to have USMLE Step 1 question of the day as an active app out there. And then we ventured out into something a little more fun with something called medical charades. The funniest moment I recall is when we were trying to do this with our family. My parents are not in medicine, whereas how Rohit mentioned, both our spouses are in medicine. And we were playing this medical charades, which was using oncology terms like pembrolizumab or CAR T cells for them to act out, and all the tongue twisters. And I really think they gave up on us at that minute.
Yes, that was an incredible night. Didn't end up well.
It didn't end well.
Well, yes, the Learn from Apps started off certainly with this gap, which still exists in the technology and the medical field. And it is very evident, though companies like Microsoft, Amazon, Apple are making a huge difference in that field. But yes, that gap still exists. So that's where we started to see whatever the basic stuff that we were doing to learn from our medical school and medical degree, if we could apply and sort of ease off that for the medical students or medical people. And Rahul used to use quite a bit of mnemonics during his studying for his USMLE, and I started adopting that, and it really helped me out. And especially when you talk about the USMLE Step 1 exam or any of the USMLE's exams, you are given about a minute to 15 seconds to answer a question with a huge stem itself. So having these mnemonics or ways to sort of respond back faster makes those exams rather less nerve-wracking. As a result, we thought about presenting those mnemonics as a list in an app form, and that's what it stemmed off. And the sort of appreciation we got from that, we stepped into this world of question bank, which was question of the day, USMLE Step 1 question of the day, Step 2 question of the day, and so on and so forth. And involving medical students and medical staff really was gratifying because they felt that they were doing well and scoring better on their board exams. So that's what really stepped off this question of the day app, which we still continue to work on. It does take some time, but at the same time, it's certainly rewarding. And then the fun element came along was the charades aspect of it, which certainly some nights are well kept as history.
Yeah. Where can listeners download the apps?
So you can access these apps out on App Store as well as Google Play Store, where there are the mnemonics as well as the question of the day app is certainly available. Though we did stem off to USMLE Step 2, Step 3, and some of the nursing apps for the questions, but not getting too much promise in response, where USMLE Step 1 did gauge quite a bit of enthusiasm. As a result, we continue on with that. Okay. But they are available in App Store as well as the Google Play Store.
Okay, we'll be sure to link to them as well in the show notes, so any listeners can download them.
And Kevin, I believe that's where at least I got interested in OncoAssist too, because I felt that is what OncoAssist was trying to do, bridge that gap between medical oncologists. And again, part of it was tech, where you can walk in to a patient with that information. And I often do that with them, saying, hey, let's pull this calculator. Let's see how much benefit you'll have with adjuvant chemotherapy for your colon cancer or your breast cancer. And I think those apps serve the physicians a lot, but also bring a whole lot for the patients as well. So.
Yeah, definitely. It's we obviously we don't get to engage with patients a lot, but that's what we had in mind when we were developing those tools. And it brings me to the next question. What do you guys see as the future of digital in oncology? Obviously, we talked about all the EHRs and interoperability and everything, but what do you see kind of, I suppose, in the shorter term and the longer term?
Yeah, so I think digital health is moving rapidly, especially now with AI making a big splash as well. I think digital health could, especially with all the AI wearables, could make a huge impact in patients' quality of life, overall survival. I don't know exactly when, but almost 3 or 4 years ago at ASCO, there was a remote monitoring for oncology patients through one of the apps that showed significant quality of life difference. And the speaker made an argument that if this was a drug, it would have been FDA approved because of the impact it made in patients' quality of life. So I think that digital health will continue to help our patients, or continue to help physicians to have that open communication and keep a better tab. And then with the AI, I really think that it will help precision medicine a whole lot better. It will help rare diseases with finding better targeted agents. Rohit and I actually had a chance to do a certification course in AI. So that was through American Board of Artificial Intelligence in Medicine, multiple for ABAIM. And again, prior to that, I had this notion that AI is out there to replace us. That's absolutely not true. I think with digital health, with AI, it will only make us better physicians. And it's just another tool in our toolkit to provide better care for our patients.
I think digital medicine is here to stay. Certainly add to what Rahul has said, that it is so rapidly changing that one has to definitely stay on top of medicine aspect of it, but at the same time, stay at the forefront of this technology as well, because how fast it is changing, it's in about 3 to 5 years. I think it is certainly not replacing the physicians, but it will replace some of the manual labor aspect of it that gets put into any of the patient care, and staying in touch with patients and sort of making it more fluid per se, which will really help patient care and take things a lot faster, where patients still have to spend so much time on phones getting in touch with physician or pharmacy or insurance and all the other aspects of it. So adding that to artificial intelligence will definitely change the medicine from the radiological aspect of it as well, because how it is helping the humans to rather read these X-ray films so much faster than what we are currently employing. So as a physician, I think it is important to stay in touch with this sort of ever-changing field and stay on top of it, because there are physicians who certainly are able to acquire the knowledge, but at the same time, applying it technologically becomes a bit challenging. So one has to be at forefront of this ever-changing field and technology to sort of make that difference in future, because it is going to come fast.
Yeah.
Along with digital health, I think if there's any silver lining with the pandemic, has been telemedicine. That is not even talking about what the virtual reality medicine could look like and give patients even a more personalized experience, if you may. And that might happen in 3, 5, 10 years. But with digital health, telemedicine in the last 2 years, I really think that has moved the field forward significantly.
Yeah. Have you tried the headsets, the VR headsets?
Yeah, actually, Rohit and I both have, and I do think that in the next little while, telemedicine will move towards that. A lot of our conferences now have the option of attending in person, which is what we're all looking forward to after the last 2 years, but also gives you a flexibility to attend virtually. What I anticipate that the next step is going to be, let's attend it in person. You can attend it via Zoom or virtually, but also the other platform is going to be VR.
I think how Bill Gates even mentioned that in one of his talks, that this might be the new forefront itself, which will certainly not replace these conferences, because adding the humanistic element to any of the conferences or patient care is certainly more important. But at the same time, a lot of it, if it was to go virtual, this will really still add the humanistic element, because when you're tied up in a room and you're still able to interact with people with this VR technology, it's going to be very big.
Yeah. Do you see an option for patient empowerment or patient engagement with VR headsets?
Yes, I would definitely see that as future, but I think that's far from future itself. Yes, but I do see it. Though how much impact it will have in rural setting is still questionable, because even in many, many years out in technological world and medicine, unfortunately, still stands where rural overall survival or survival is not significant as opposed to the urban world where you have access to the clinical trials, more education, more socioeconomic differences aspect of it. But yes, it is going to make that difference, but coming out to the rural world, it will take some time, I'd say.
And the other thing, I think the issue I also see first, telemedicine. Pandemic moved that. Telemedicine was there even before that, but as physicians and patients, we got more used to it over the last 2 years. So I think it'll take some time for everyone to absorb that better and start to use that better. The big thing with the VR, I tend to see ends up being our patient population, elderly, frail, and for them to have like such a big hardware to manipulate ends up being tough. So I think the next little while, as the hardware gets better and better, I think that will make a big impact as well.
Yeah, we've started to do some of our meetings in workrooms, and which is very, very, it's a huge step, a huge improvement. So it'll be interesting to see if that's adopted as in the coming years.
Technology companies change as well, of course, with the headset aspect of it, but at the same time, how these virtual rooms become a bit more accessible for companies to even sponsor such events, because they are quite pricey to even rent out those spaces right now. So once it is a bit more accessible, I think a more technological world like Amazon, Apple, and Microsoft will make a huge impact from that standpoint.
So my final question, for any patients and caregivers listening to this, what are your tips on navigating cancer care?
I often tell my patients that patients and their family members are their best advocate. So I really think asking more questions. I often encourage them to read more, even with the internet. The important part ends up being us guiding them to the right source is very important, rather than them relying on anecdotal experiences or forums. So guiding them to the right source of information is very important. Historically, if a patient or family member is looking for a second or third opinion, it's looked down upon. I often encourage them to look for that opinion. Partnering up with tertiary and quaternary care ends up being very important, and the sooner the better. Exploring clinical trials where in community or rural areas, the enrollment for from community oncologists for clinical trial ends up being very low. So encouraging our patients to explore that option, I think all that ends up being very, very important. So continue to do that, ask more questions, and on our end, hopefully we'll continue to make community oncology better and better.
What would be like a source that you'd recommend that they reference?
So often a lot of quaternary hospitals will have their pages, Mayo Clinic, Hopkins, University of Rochester. UpToDate has a patient information portal whenever we're recommending a medication, we'll give you a chance to print that out for the patients. NIH, NCI, particularly NCCN, they all have dedicated section for the patients. And I often will refer them to that, saying, I strongly encourage for you to read. Let's have discussions. I will often print them out, some material. And for some of our more sophisticated patients, I will even go as far as printing them the newer studies, just so that we can discuss on their next follow-up.
Okay.
Right, so I feel like anytime we are seeing patients, it becomes important to educate the patients and their families for the diagnosis and the treatments that they are going to embark on. I try to usually go up on the board and try to draw some images, which will be a bit more pictorial view of what they have and the medicine that they'll be going through. And they oftentimes just take a picture of it because that's rather easier for them to sort of interpret. But at the same time, prior to initiating any chemotherapy or any systemic therapy, targeted therapy, they get education from us, the nurse navigators, as well as we give them a handout for chemo consent and teach prior to initiating any of these drugs, which lists the side effects or the mechanism of actions. In addition to that, UPMC Hillman Cancer Center has resources available for patient care itself, which does have a list of all these information about the drugs and the diagnosis, and certainly relying on the NCCN guidelines aspect of it, up to date, which are where all these reliable sources where the patient information is available from the diagnosis, the systemic therapy standpoint, and the side effects. So that becomes often very important because those are the standard of care guidelines. In addition to everything, I always encourage the patients and their families to reach out to us if they have any questions. You do not have to wait until the appointment is here. We have all the resources available that will get you the right answers, whether that's social worker, if they're having any social issues. So all these resources are set in place, and patients often are pretty happy about such resources and support that is available at their back end.
Thank you both for your time today. That was very interesting. And yeah, we look forward to seeing Oncology Brothers develop over the coming months and years.
Thank you so much, Kevin, for your time and giving us a chance to sort of talk about the Oncology Brothers as well as important aspect of medicine and oncology. Thank you so much for your time.
Thanks, guys.
Thanks for having us, Kevin.